it's me again, Sander. How are you? I am back. Oh my God, parang kailan lang. Hold on, give me a few minutes, like less than 30 seconds. I need to share this one. Soaring high and making difference. Where we talk anything about nursing. So let your voice be heard. Right here, Moments with Professor X. Yun nga, I am back. How's everybody? Today is actually Thursday, my time. And, ano oras na ba? It's 6:29 p.m. So, technically, what time is it in the Philippines? I guess 9:29, 9 or 9:30 ng umaga. So, my time is 6:30 p.m. How's everybody? Okay. Anyway, if you happen to read the title, so we will talk about prioritization this time. And a student requested if I can discuss prioritization. So here it is. This is for you. But anyway, bago ang lahat, I would like to extend my, sincere and heartfelt condolences to those who passed away and sa mga pumanaw dun sa Lapu-Lapu Festival sa Vancouver, Canada. I was there. When was that? I was there a few days ago, and then stayed there for a couple of days before flying back here in Las Vegas. So buti nilang hindi ako nasama dun sa casualty. Nakakaloka. Oh God. So, I heard investigation is still going on. So, kung ano ba talaga yung reason why that incident happened. So, I just hope na whatever will be the investigation, it will be fair and just. Especially those who sa mga victim po ng incident na yun. We're not expecting that incident. I mean, that day should have been a celebration of Filipino culture in Vancouver, Canada. But anyway, we're here. Ang gulo ng Pilipinas. Ang gulo ng politiko sa Pilipinas. Ang government natin, my God. Somebody has to, shape up and make a difference. Nakakapagod minsan nga, no? Naging political yung aking, platform. But anyway, I just wish everybody in the Philippines to vote wisely. No? Kaya minsan nga, ako personally, please don't get me wrong and please don't get mad at me. Sometimes, napapaisip ka na, is it still okay to tell, and is it still okay to be proud na maging Pilipino sa mga nangyayari sa atin dyan sa Pilipinas? Walang katapusang conflict, just because of power, just because of money. Oh God. Mag-lecture na lang tayo. Anyway, let me check kung naka-live ako dun sa isang page. Give me a few minutes. Anyway, big shout out. Thanks for watching, May and Balilid De Facto. Thanks for watching. Who else do we have here? So anyway, for this session, we will talk about prioritization. Remember, this is a common question whether you're planning to take a qualifying examination in the Philippines or somewhere else. But this has something to do with the nursing profession qualifying exam. They always ask prioritization. Why is that so? Because they want to know whether you have an idea what nursing is all about, whether you are a safe nurse or not. Okay, that's the main line why they want to evaluate you, gauge. Ano ba to? They want to know whether you're a safe nurse or not. So you should know how to prioritize patient. Okay, so let's move on. So let me share my screen and then let's go from there. Ooh. There. Tama ba? Meron tayong nag-comment. Hello to Diary Espiritu. Hello sir, kumusta po? Como esta? I'm all good. How about you sir? Discuss ka din ng hemodynamics soon. Okay. So when you say hemodynamics, the parameters or test to evaluate hemodynamic stability of your patient. Okay. So, we will discuss that. If I have time later, no, pag hindi pa umabot ng 1 hour, I will discuss hemodynamic parameters. Okay. So, let's talk about prioritization, okay? Anybody who is planning to take the examination anytime soon? Prioritization. Hello to my aunt, Ira Pascasio. Thanks for watching. Prioritization. Natawa ako dun sa text, sa message mo kanina. Prioritization. So again, parang wala ako sa sarili, pero akong lutang ngayon na nagdi-discuss. Okay, so let's talk about, kanina ko pa sinasabing prioritization. Okay, so what are keywords in your examination that will tell you that this is a type of question that has something to do with prioritization? Words like see, words like attend, words like assess first. Okay, so when you see these phrases like who will you see first, who will you attend first, or who will you assess first? Okay, so these are words that has something to do with prioritization, correct? Now, there are 3 common ways in your examination how to answer questions about prioritization. Now, it's all up to you to decipher which one is appropriate, okay? Which way is more appropriate, okay? Now, what are those? First, you can answer prioritization based on ABC protocol, the most famous ABC protocol. When you say ABC, we're talking about airway, breathing, and circulation, correct? So it means to say that if you encounter several patients in several cases on the floor, who among those patients will you see first? Of course, a patient with an airway issue, followed by a patient with a breathing concern, and last, patient with circulatory problem. Okay, that's your ABC protocol. This is the most famous one. Okay. Second way to answer prioritization is to understand the basics of your Maslow's hierarchy of need. Okay, Maslow's hierarchy of need. We'll talk about that in a bit. And of course, the third is safety. Okay, safety. So when you say safety, I am talking about safety, your safety as a nurse, and safety of your patient. Okay. Now I will give you 3 common questions, and then I want you to be truthful with your answer. Okay. And then from there, i-discuss natin sila isa-isa. Okay, let's deal with this one first. The first question. Okay, question number 1. Talagyan natin number 1. Okay. Now, a CNA stands for Certified Nursing Assistant. Okay. A CNA called your attention regarding patient's condition. As a nurse, who will you attend first? By the way, if you're planning to take the NCLEX exam, regardless whether it's an NCLEX R or NCLEX RN or NCLEX PN, the actual question in your examination are very short. It could be a 2-liner or a 3-liner question. Never pa ako nakita na question when I took the examination na ganun kahaba, na very lengthy. Okay, even I asked some students who took the examination, they will tell me, "Sir, short lang talaga yung question." Yeah, which is real. Okay, kaya nga sometimes if you have your reviewers at home, if you have several books, NCLEX reviewers, when you look at their sample questions, it's very lengthy, ilang sentences, isang paragraph na, but in real examination, in actual exam, very short. 2 or 3-liner question only. Okay, just like this, it's a 2-liner question. Okay, so again, you saw the word attend. It means to say, who will you see first? Okay, or who will you attend first? Who will you assess first? Again, a question about prioritization. Option number 1 or letter A, a PTB patient in a negative pressured room. When you say PTB, pulmonary tuberculosis, remember pulmonary tuberculosis is a highly infectious respiratory infection caused by a tubercle bacilli. Okay? Now, in order for tuberculosis to be highly communicable, in order for tuberculosis to be airborne spread, it must be pulmonary in nature. Remember, there's such thing as extrapulmonary tuberculosis. Okay? And take note, the patient is a negative pressured room. Yes, patient with airborne infection must be placed in a negative pressured room. Not only that, if you're the nurse taking good care of that patient, when you get inside the environment of the patient, like when you get inside the room of your patient, you need to wear a HEPA filter mask. Okay, when you say HEPA filter, we're not talking about the liver. HEPA is an abbreviation that stands for highly efficient particulate air filter. So one good example of your HEPA filter mask is your N95. Okay, the question here, will this be a concern? A PTB patient in a negative pressured room, will that be a concern? Yes or no? Some would say yes, some would say no. But for me, it's a concern. Why? Because pulmonary tuberculosis is a highly communicable infection. And guess what? Here in the US, your BCG vaccine is not part of their immunization program. That is why if here in the US you got tuberculosis, pulmonary tuberculosis, it's a big thing. Okay? They will freak out. Okay? So that's your tuberculosis. But the question there is, will you attend the patient first? Remember, there's another word, first. Okay, the answer is no. It's a concern, but ideally, if your patient is on isolation precaution, except for reverse isolation, if your patient has a communicable disease, you need to see that patient last, not first. Why? Because if you go to your patient room with a communicable disease or infection, you see that patient first and you get out, you go to other patient, there's always a risk you as a nurse will spread the infection. So that is why as much as possible, you see the patient last, okay, for safety. Okay, letter B, a patient with sudden aphonia. Take note of the word sudden. When you say sudden, acute onset, okay? Now, if a condition occurs suddenly, so fast, if a condition happens acute, it's a red flag, okay? Aphonia. What is aphonia? Okay, I mean aphonia. Aphonia, nasa isip ko. Aphonia is a medical term that describes loss of voice. Okay? Loss of voice. So there's sudden loss of voice. Is that a concern? Yes, it is. Why? Because if your patient suddenly develop loss of voice or sudden aphonia, it means to say that there is complete airway obstruction. Now, if the airway obstruction is partial, okay, or partial obstruction, most likely the patient will exhibit noisy breathing. One good example of noisy breathing will be wheezing sound or stridor, just like for patient with asthma attack, right? For patient with asthma, they have expiratory wheezes. That is why if you have a patient with asthma and initially they have a noisy breathing and then moments after that, there's total silence, do not rejoice. Don't be glad. Okay, why? Because if there's sudden silence, it means to say from partial airway obstruction, it progresses to complete airway obstruction. Okay? So, is letter B a possible answer? Yes, it's a possible answer. Why? Following our protocol, your ABC protocol. Hey, where's that? Following your ABC protocol, ABC, A is airway. So, most likely B is the correct answer. Okay? But let's proceed. Let's check on other options. C. A DKA with hyperventilation. DKA is diabetic ketoacidosis, which is a common complication of patient with type 1 diabetes mellitus. Remember, DKA is a form of metabolic acidosis. So if the patient is having metabolic acidosis, if you check the ABG result of your patient, you will see that there is a decrease in the pH and a decrease in the bicarbonate. Okay? So the pH is low. That is why part of DKA manifestation is that there is hyperventilation. Hyperventilation is compensation, okay, to your metabolic acidosis. Why? When you hyperventilate, hyperventilation can cause carbon dioxide elimination. right? So when the carbon dioxide is being expelled excessive amount, that decreases carbon dioxide in the body, leading to respiratory alkalosis. So it means to say that hyperventilation is compensation, okay, of the respiratory system towards metabolic acidosis. Why? In hyperventilation, the body is trying to expel carbon dioxide to increase the pH because the patient has metabolic acidosis. I hope that makes sense. Now, in short, hyperventilation is expected to patient with DKA. Remember, in your NCLEX, any condition that is expected, no need to notify the doctor. And again, another thing, hyperventilation is not an airway issue. It's a breathing concern. Okay? So that is your second priority. Okay? And look at your letter D, a COPD patient with an O2 saturation of 91%. Remember that the normal O2 saturation is 95 to 100%. But take note, it's very clear that here your patient is a COPDer. So if your patient is a COPDer, okay, if the patient is COPD, their normal O2 saturation is equal or greater than 90%, not 95 to 100%. So this 91% here is okay for your patient. So we have to eliminate Charlie, and you have to eliminate Delta. So you have to choose between Alpha and Bravo. Okay, so between Alpha and Bravo, you remember, you have two options left. You have 50% chance of getting the correct answer. The best answer here is actually Bravo. Okay, sudden aphonia. Why? Because of an airway issue. It's an indication of complete airway obstruction. Okay, let's proceed to question number 2. I think this will be quick. Okay, question number 2. Kamay sa dibdib. Okay. Question number 2. The nurse is planning care for several patients. Which client must the nurse attend first? Here we go again. Attend first. Question about prioritization. Number 1, a patient complaining of mild headache. It's only mild. Okay? Remember, headache is a general presentation. If you have electrolyte imbalances, you may experience headache. If you have lack of sleep, you may have headache. A patient with hypertension will also have headache. Therefore, headache, mild headache, is a general presentation, a general manifestation of a patient that needs further evaluation, that needs further assessment. Okay? So number 1 is not the best answer. Look at your number 2. A patient with loose bowel movement requesting for a glass of water. So your patient is having diarrhea and requesting a glass of water. Remember, if you're diarrhea, one major issue is dehydration, your fluid volume deficit. Okay? So is that a possible answer? Could be. Okay? What about number 3? A demented patient ready for discharge. Remember, ready for discharge. If you discharge the patient, it means to say that the patient is stable. Correct? Because we never discharge the patient who is unstable. Okay? It means to say patient here is stable. Okay? And is about to discharge or ready for discharge. So number 3 is not the best answer. Next, number 4. A patient who is post-appendectomy with a pain score of 8/10. And what is this? It's severe pain. Correct? It's severe pain. And guess what? Patient is asking for pain medication. Now, patient is in severe pain. Severe pain. Patient is in pain. Is that a priority? Yes, it is. But is that your first priority? We will see. Analyze. Patient is post-op. Therefore, if your patient is post-appendectomy post-op, is pain expected? Yes, it is. Therefore, your severe pain post-operatively is expected. By the way, prior to that, hello to Keith Sagrado Butali. Thanks for watching. Okay, so number 4, it's expected. Now, going back to your ways in answering prioritization. Remember, the second way is your what? Maslow's hierarchy of need. I don't know if you're familiar with Maslow's hierarchy of need. It has 5 tiers, right? One, two, three, four, 5. Okay. The first two tiers will be your physiologic need. Next will be your psychologic need. Psychologic need. And this one on top is your self-fulfillment need. Okay, I hope you can read my penmanship. Hello to my Aunt Illa Jill Banares Agabon from Hawaii. Now, when you say physiologic, we're talking about water, air, shelter, food. That's your physiologic. When we say psychologic need, it means to say sense of belongingness, intimacy. That's your psychologic. Now, look at your number 4, pain. My question here, pain. Is pain a form of physiologic or psychologic need? Can you answer? Tell me, is pain a form of physiologic or psychologic need? What do you think is the correct answer? The correct answer is psychologic need. Don't forget that. Pain is not physiologic, but psychologic need. Therefore, pain is your second priority here. Now look at your number 2. Patient is having diarrhea and asking for a glass of water. Diarrhea can cause dehydration, and the earliest sign of dehydration is thirst. Water. So you have to meet first the physiologic need of your patient, then followed by psychologic need. Therefore, the best answer here is number 2. Okay, I hope that one is clear. Hello to Pi Nikki. Thanks for watching. Or thanks for the stars. Wait, I didn't know that I can get stars. Thanks. And this one, just an additional. A client with a very dry mouth, skin, mucous membrane is diagnosed of having dehydration. Which intervention should the nurse perform when caring for a client diagnosed with fluid volume deficit? Okay? Now, sometimes I don't know if you agree with this, there are times that when you answer question, you don't understand the question. There are times that there are words being used and you don't know what those words are. Correct? So there are times that you just don't know what the answer, and that's a fact, that's a reality. If that happens, go to the options and look for the options that is unique from the rest. Even if you don't read the situation, even if you don't read the question, sometimes the hint is actually in the option. Look at your 1, 2, 3, 4 options. This is question number 3, correct? Assessing intake and output, it's ISONOS. This is a form of assessment. Obtaining weight of your patient, daily weighing your patient is a form of assessment. Getting ABG of your patient, checking the result is a form of assessment. Maintaining IV therapy, this is a form of intervention. Right? So that is why even if you don't read the question, just look at the options, you will have a hint which one here is different. Among the options, number 4 is different. Why? 4 is intervention, the rest of the options are assessments. Right? Now go to the question. Look, a client with a very dry mouth, skin, and mucous membrane is diagnosed of dehydration. Which intervention should the nurse perform when caring for a client diagnosed with fluid volume deficit? Remember, the thing being asked here, look at the second word of the second sentence. Intervention. The thing being asked is intervention. So you know that the correct answer is number 4. Make sense? And what else? If you'll be asked what is the most appropriate action, if you will be asked about the appropriate action, do not forget the nursing process. Now, what's the nursing process? If you can still recall, you had your ADPI. Okay? This is the Bible of our nursing intervention. The Bible of your nursing action, your ADPI, the nursing process. A stands for assessment. D stands for the diagnosis. P stands for planning. I for your intervention, and E for evaluation. So if you'll be asked what is the most appropriate action, what will you do? Look, A, assessment. Did we do assessment? Yes, look, We already had an assessment here. It was clearly stated that a very dry mouth, skin, and mucous membrane, in short, assessment was done. D, diagnosis. Of course, here, diagnose of dehydration. Okay? So what should be the next step? Planning. But remember, you were not asked about the next step called planning. The thing being asked is intervention. So the thing being asked here is intervention. You skip planning, intervention is being asked. Okay? Another tip in your examination. Remember, the first statement, the first sentence, what data are this? Okay? What data are this? Remember, in your nursing care plan, there are two types of data, right? So you have your subjective data and objective data. When you say subjective data, these are statements issued by your patient or a statement issued by a caregiver. We say caregiver, somebody who is in direct care of a patient, maybe a family, a relative, or a fellow member of the healthcare team, okay? Someone who's in direct care of your patient. Statement, verbalization, that's your subjective, something that is not measurable, okay? When you say objective data, these are your something that is measurable and something that can be gauged, okay? Just like your vital signs, those are your objective data. Now, go back. Very dry mouth, skin, mucous membrane. What type of data is this? Is this subjective data or objective data? It's clear. This is a form of objective data. Now, technique in your examination. If the data given to you is objective, your action there is intervention. If the data given to you is subjective data, your action is assessment. Please do not forget this. This is powerful in your examination. Okay? If you are in doubt, assessment. Subjective data, assessment. If you encounter the word appears to have, in short, it appears not absolute. It needs further evaluation. It needs further digging. It needs further assessment. Okay? Verbalization appears to, unsure, you do assessment. But if the data presented is objective, what will you do? Is intervention. Okay? Holy cow. Nahulog yung aking armrest na. Okay? Anyway, who do you have here? Hello to Ahmad Nabhan. Hi sir, hey, here I am again. Nasa Pinas na ako to take my NCLEX soon. Thank you for this. Welcome. When is your exam date for your NCLEX? I wish you luck on your examination, Ahmad. Okay? Okay? So those are common things you need to remember. And by the way, last is your safety. Now, when you say safety, now who's the priority here? It's your first and second priority. When you talk about safety, your first priority is yourself. Okay? Or the nurse, safety first. And the second priority here is your patient's safety. Remember, I am not saying that your patient's safety is not a priority. It's just that it's a second priority. Your first priority is your safety first. Even in triage nursing, remember the first action in triage nursing, okay, in your emergency nursing, not triage, in your emergency nursing is survey the scene. Remember, that's the first thing to do. Survey the scene. Why would you survey the scene? You survey the scene whether to check it's safe for you to help, safe for you to intervene. Why? Because if you will not survey the scene, you would just go there and help do your stuff. There's a risk that you get what? Hurt or be part of the casualty. So to prevent that, take note, first is consider your safety. That's the reason why you have your PPE. The reason why you wear PPE is to protect yourself. Remember, your safety first. Second is your patient safety. Okay? What else? Anything else? Anything else? Did I miss anything? And there's a question here. Ano nga yun? Hemodynamic. This, okay, I'm just supposed to discuss prioritization, but there's a question here to discuss hemodynamic from Dari Espiritu. I don't know if you can read that. This one. Hemodynamic. Okay, so we'll talk about hemodynamic. I'm reading some of your messages, guys. Okay, some of your comments. So please let me know if you have any specific topic that you want me to discuss. Let me know. Ahmad, kailan po next live ninyo? I still don't know when will be my next live session, but if I got bored, I usually stream. Oh, by the way, I stream this to my YouTube channel and to my Facebook page. So let's talk about hemodynamic stability, your hemodynamic parameters. Hey, what is that? Ooh. I want to change that to color black. Hey! I'm supposed to erase that. There. Okay, let's talk about hemodynamic. Okay? So you say don't worry. Anyway, okay, ganito na lang, Ahmad. Since you're planning to take your examination anytime soon, please send a private message. I'll give you some notes. Okay? I'll give you some notes, pointers about for your NCLEX RN. Okay? Please send a private message to me. Okay, so hemodynamic, what are the different parameters we use to evaluate or check hemodynamic stability? Okay, of course, number one, we check vital signs of your patients. Okay? Your vital signs will give us the general health condition of your patient. Dari Espiritu, yay, thank you. Welcome, Dari. Okay, vital signs. Okay, your vital signs will also reflect hemodynamic functioning of your patient. So remember, vital signs will differ according to its age bracket. Okay, so we have a different specific heart rate limits for adult, limits for pediatric, limits for neonate. So please check the normal vital signs. Okay, their normal ranges. Next, another hemodynamic functioning that you need to understand will be your CVP. Okay, your CVP stands for central venous pressure. Okay, do not forget that the CVP is a test that evaluates right side of the heart functioning. Okay, so if the CVP evaluates right side of the heart functioning, what is the test that evaluates the other side of the heart? Okay, the left side of the heart is being evaluated by PCWP. What is PCWP? Pulmonary capillary wedge pressure. Okay, and anyway, things to remember about your CVP. An increase in your CVP indicates hypervolemia. A decrease in your CVP indicates hypovolemia. No problem, Ahmad. Okay? Please send a message now. Baka makalimutan ko. I might forget that. Send a message now so I can send you the mga pointers for the NCLEX exam. Okay? That's your CVP. Number 3. Another parameter that will evaluate hemodynamic functioning of your patient will be your ABG, arterial blood gases. Okay? So, your arterial blood gases will evaluate perfusion, okay, oxygenation, evaluates metabolic status, and of course, respiratory status of your patient by getting an arterial blood sample. Okay? Now, remember in your NCLEX that before you draw blood for ABG, you need to do a specific test. You call that test as your what? Allen's test. Okay? Your Allen's test will evaluate collateral circulation of the radial artery and the ulnar artery. So this is your radial artery, and this part here is the ulnar artery. So there are values you need to remember. Okay? So in your ABG, the pH, normal pH is 7.35 to 7.45. Okay? An increase in the pH, okay, is alkalosis. A decrease in the pH is acidosis. Next, part of your ABG is your partial, okay, oxygen pressure. The partial oxygen pressure ranges from 80 to 100 millimeters mercury. Take note, we're using millimeters mercury because we're talking about partial oxygen pressure. Okay? Now, if the oxygen is greater than the limits, increase in the partial oxygen pressure, you call that condition as hyperoxemia. Okay? A decrease in the partial oxygen pressure is hypoxemia. Next, partial carbon dioxide pressure. The partial carbon dioxide pressure ranges from 35 to 45 millimeters mercury. Okay? And last is your HCO3, and this is your bicarbonate. Bicarbonate is actually produced by the kidney, which is part of your buffer system. Okay? And bicarb is alkaline in nature. So you know that if bicarb is alkaline, and alkaline neutralize acidity, if there's too much bicarb, it follows that you will have alkalosis. If there is decrease in the bicarb, nobody but you, okay, nobody will neutralize acidity, so you will end up having acidosis. Anyway, the normal bicarbonate ranges from 20 to 20. What is this? Ahmad said, I can't send you message here in FB. Sa Instagram na lang po, sir. Sure. So send me a direct message sa Instagram. Send me your email so that I can forward pointers for your NCLEX. Okay? And you did not mention when is your exam date for your NCLEX exam. Anyway, bicarb, normal bicarb is 22 to 26 milli equivalent per liter. Okay, take note, these are the normal arterial blood gases values, which is different from your venous blood gases values, especially for your partial oxygen and your carbon dioxide. Okay, so sometimes they do venous blood gases, sometimes they do arterial blood gases. Okay, so don't forget that. Number 4, okay, another parameter that will reflect hemodynamic condition of your patient is patient's urinary output. Okay, urinary output. Now, why? Because if there is poor hemodynamic functioning, poor perfusion, it affects renal function. It affects renal perfusion. A decrease in the GFR or glomerular filtration rate will result to a decrease in the urinary output. And it follows that if there's an increase in the GFR will also lead to an increase in the urinary output. Okay? So an increase in the GFR will lead to an increase in the urinary output, and a decrease in the GFR will also follow that there will be a decrease in the urinary output of your patient. That is why if you're familiar with shock, what is shock? Anyway, hello to Mendes Shah. Thanks for watching, and hello. Yeah, Mendes Shah. May 14 is your exam date. Oh my God, that's near. Are you ready to take your NCLEX, Ahmad? Please, please, please. I don't want you to fail. Read, and of course, please, now study the pointers that I will give you later. Anyway, let's go back. Now, are you familiar with shock? What is shock? Shock refers to a condition wherein there is abnormal perfusion, altered state of perfusion, right? Now, there are different types of shock. You have your cardiogenic shock, hypovolemic shock. What else? What type of shock that you know? Hypovolemic shock, anaphylactic shock, right? So technically, if the patient is in a state of shock, there's altered perfusion. There is no enough blood that perfuses to your renal area, to your kidneys. So there's poor circulation to your kidneys, it affects GFR. Okay? By the way, what is the normal GFR and the normal urinary output? The normal GFR is about 125 ml per minute. Yeah. The normal GFR is about 125 ml per minute. Okay, that's the GFR. But the urinary output will range from 30 to 60 ml per hour. Okay? So the urinary output is expressed ml per hour, but the GFR is expressed at ml per minute. Okay, what is this? Ahmad said, I am ready. 6 months preparation, sir, while working in cardiac ICU. Who? Claiming it, sir. Yeah, you will pass, don't worry. Inshallah. Did I say it right? Inshallah or inshallah? Wow. Good luck in your examination. Okay? So these are just common parameters that will evaluate hemodynamic function of your patient. Okay? Anyway, what else? What else? What else? Tell me. What else do you want me to discuss? Inshallah. Oh yeah, inshallah. Okay, I said it right. It means to say, what do you mean inshallah? In God? What do you mean by inshallah? God's will, right? God's will. All right, correct me if I'm wrong. Ahmad. Inshallah in Arabic, in English, is that God's will. Yes, sir, God willing. Okay. Anything else, Ahmad, that you want me to talk about? Okay, let me check this one. If none, I think we'll call it a day. Nag-live ako ng 42 minutes. Sir, pwede po yung endocrine. Okay, endocrine. What specific problem in endocrine? SIAD and DI. Okay, this is the message. I don't know if you can see this one. SIAD and diabetes insipidus. Okay, quick review about SIAD and diabetes insipidus. Okay, so SIAD or syndrome of inappropriate antidiuretic hormone versus diabetes insipidus. The main hormone here is your ADH. Okay, what does ADH stand for? ADH stands for antidiuretic hormone, or you also call this as your vasopressin. Okay? Remember that your vasopressin or antidiuretic hormone is a hormone produced by the posterior pituitary gland. Remember, your pituitary gland is divided into two, anterior and your posterior. Anterior produces 7 hormones, posterior produces 2 hormones, okay? And one of those 2 hormones, okay, one of those 2 hormones is your ADH or your vasopressin. Now, what is the function or effect of your ADH? Remember, antidiuretic hormone. Antidiuretic, it prevents formation of large volume of urine. Okay, so again, it prevents formation of large volume of urine. Okay, so it prevents formation of large volume of urine, or to make it simple, ADH is important for water reabsorption. Take note of the word I'm using. I said reabsorption. I did not use the term retention. Okay? Your aldosterone is for water retention. ADH is for water reabsorption. Okay? Now look at the different disturbances here. So you have hypersecretion of antidiuretic hormone and hyposecretion of antidiuretic hormone. Now, if there's too much ADH in the body, there's too much water being reabsorbed. That is why if there's too much water being reabsorbed, it causes a condition called SIAD or syndrome of inappropriate antidiuretic hormone. If there is hyposecretion of ADH, this will result to a condition called diabetes insipidus. Now, highlight in your examination. Regardless of the disorder or the disturbances, hyposecretion, do not forget that your antidiuretic hormone imbalances is actually related to head injury or patient who had head surgery. Why? Unknown. Okay? So a patient who had had surgery, a patient who had had injury, most likely they will end up having ADH imbalances. So it could be a form of SIAD, it could be a form of diabetes insipidus. Why? Unknown. That is why in NCLEX, if you will be asked who among patients below at risk to have SIAD, at risk to develop diabetes insipidus, anything with ADH imbalances, look for a patient who had had surgery or had injury. Okay, now let's proceed. Now, if patient has SIAD, remember, paano ba yan? Let's remove this. Okay, now a patient with SIAD, a syndrome of inappropriate antidiuretic hormone, other side is your diabetes insipidus. Remember, in SIAD, there's hypersecretion of antidiuretic hormone. So more water is being reabsorbed. That is why if there's too much water reabsorbed, this will result to fluid volume excess. Right? In diabetes insipidus, there's hyposecretion of antidiuretic hormone. A decrease in ADH means no water is being reabsorbed. If there's no water being reabsorbed, what will happen? This will result to fluid volume deficit. Okay? Now, highlight in your NCLEX will be features of your patient. Do not forget this and select all that apply. Now, a patient with SIAD, because of too much water being what? Being reabsorbed, this will result to a condition called hemodilution. Now, why is the blood diluted? Because of too much water being reabsorbed. And what specific laboratory test will confirm and support that there is hemodilution? Answer, hematocrit. So what will be the result in your hematocrit if the blood is diluted? Answer, there is a decrease in your hematocrit. So if the hematocrit is low, that indicates hemodilution. Next, number 2. Okay? Now, because of hemodilution, you check the urine of your patient. Is the urine diluted or concentrated? Remember, there's hemodilution. Hemodilution. What happens to the urine? Urine is actually concentrated. Now, what specific test confirms that the urine is concentrated? Answer, urine specific gravity. So what is the result in the urine specific gravity? Answer, elevated. Okay? And number 3, do not forget this, a patient with SIAD because of hemodilution will end up having a condition called hyponatremia or a decrease in the sodium. Okay? Sir, expound why. Remember, this is your blood vessel. Okay? Let's say this is your kidney. Okay? Your kidney. Remember the kidneys now with the process of, micturition process, it will eliminate your waste products in the form of urine. And here in SIAD, there's too much ADH. So analyze. If there's too much antidiuretic hormone, more water is being reabsorbed. So what will happen here is that the water from the urine is taken out and this water enters the bloodstream. Okay, therefore, if the ADH will promote water reabsorption, the water is being reabsorbed. So in the urine, there's no more water because water is taken out. Therefore, if the urine has no water, the urine is concentrated. Okay? How will you know that the urine is concentrated? The specific gravity is elevated. Now, where did the water go? Since the water is being reabsorbed, water enters the bloodstream, the blood becomes what? Diluted. So there's hemodilution as evidenced by a decrease in the hematocrit. Because the blood is diluted, it follows, it dilutes the sodium out, causing hyponatremia. The cause of hyponatremia here is not sodium deficiency. The cause of hyponatremia is water toxicity. Okay, that's water toxicity, hemodilution. I hope that's clear. Now, what about on the other side? Okay, total opposite. That is why, don't forget, if you're planning to take any qualifying examination and the question has something to do with the endocrine, don't stress yourself. Just familiarize one disorder. If it's hypersecretion, memorize or familiarize hypersecretion. You flip that, those are signs and symptoms of your hyposecretion. Okay? Now look, in your diabetes insipidus, now we call it diabetes insipidus, just like your diabetes mellitus, there is polyuria, there is polydipsia. Okay? So same, there's polydipsia and polyuria. Now, because of deficiency in your antidiuretic hormone, no water is being reabsorbed. So if there's no water being reabsorbed, water goes to your urine, what will happen to your blood? Blood becomes concentrated. So you will have here hemoconcentration as evidenced by elevated hematocrit. Next, now what about the urine of your patient? Remember, no water is being reabsorbed. The water is filled with, the urine is filled with water. So that makes the urine what? Diluted, as evidenced by a decrease in the specific gravity. So it means to say, there's too much water in the urine, you keep on peeing. Ihi ka ng ihi. That is why technique for Filipinos, DI, diabetes insipidus, you also say that as daming ihi. So kung daming ihi, ihi ka ng ihi, it causes fluid volume deficit. Okay? And number three, patient with what we call diabetes insipidus, you will end up having what? Because of hemoconcentration and of course polyuria, the patient will have what? Tell me. Will you end up having hemoconcentration? Will you end up having hypernatremia or hyponatremia? What is this? Ahmad Nabhan said, opposite lang po. Very good. Very good. Here, of course, because of hemoconcentration, you will have hypernatremia. The cause of hypernatremia here is hemoconcentration. Okay, take note. Total opposite. Okay, total opposite. Hyposecretion of ADH, no water is being reabsorbed. Water goes to the urine. The urine becomes what? Diluted. No water is reabsorbed. The blood becomes concentrated. Because of hemoconcentration, it increases concentration of the sodium, resulting to hypernatremia. Okay? I hope this one is clear. Ahmad, did I answer your question? Now, how do you treat patient with SIAD? The treatment for patient with SIAD is you give diuretic. The treatment for patient with diabetes insipidus is you give antidiuretic hormone. Now, what are examples of your antidiuretic hormone? Doctors may prescribe desmoresine. Doctors may prescribe desmopressin. Doctors may prescribe pitressin. Doctors may prescribe a vasopressin tannate oil. Do not forget, if it is vasopressin tannate oil, it must not be given IV. Vasopressin tannate oil is given deep IK. Vasopressin tannate oil is given what? Deep IM, Z-trap technique. Okay? Some of your ADH medication can be given nasal spray. Okay? Pressin. Very good, Ahmad. Your pressin. Okay? Did I answer your question, Ahmad? I hope this short live, Facebook Live, somehow help you with your NCLEX struggle. I'm just supposed to discuss prioritization, but it's fun. It's nice that some topics will just, pop, and then I will discuss the specific topic, your requested topic. Thank you sa review ulit. Welcome, Ahmad. Thank you so much. Anyway, guys, thank you so much for your time. Okay, and then I just hope that whoever is planning to take the examination soon, whatever am I doing here, Facebook Live, I just hope that hey, where's this? Hey. Stop sharing screen. There you are. So yun na. So whoever's planning to take the examination, I hope yung mga ginagawa ko dito will help you. Okay? God bless everybody. Keep safe.